What's up, everyone? Dr. Bo here. Today we're talking neck pain, we're talking numbness and tingling all the way down into the fingertips, what it probably is, what it may not be, and how we as chiropractors can help it. Stay tuned.
How can I help you today?
All right, back for another episode of Ask Dr. Bo. I did these for a while, then I got away from them, and I think I'm going to probably get back to them because I'm getting lots of emails of people asking me questions. So here's the question. Sarah asks, "Hey, Dr. Bo, I've been experiencing some neck pain with numbness and tingling down the outside portion of my arm into my fingertips. It is worse when I wake up in the morning and when I am at work for a lot of hours working on my computer. What's going on?" Okay. Sarah, this is something that happens a lot. It's something that I see a ton here in our practice. Let me explain a little bit first off as far as what's going on. So, got my handy dandy little spine. So this is the neck portion. This is the person looking this way, just so you kind of give a little bit of reference back of your head. As you can tell, there are bones here. There's little spots here and here. Those are called your discs. And these yellow things that come out, those are your nerves. Nerves come out of every little hole here on the side of the neck right here. There you go as well, right? Each one of these nerves goes to different places. So how does that work and why? Well, when you fall asleep and your neck kind of, we're supposed to be this, but if our neck gets kinked up a little bit or kind of collapses down a little bit, sometimes we get some pressure on these muscles. They tight, they spasm. That's why you get the locked neck. And you can hit some of those nerves. And wherever you hit the nerves, that's where you feel the numbness and tingling going down into the hand. Now, secondly, we talked about our neck being here, but when we work at a computer, especially, or a laptop, computer, we tilt our head down. So our head kind of starts going like this a little bit. So we're creating like this, I'm trying to get this motion of things being pinched right here, right? See if I can bring that back into focus a little bit. Yeah, there you go. So these things get pinched, and when that gets pinched, it gets really, really, really bad. And like I said, you get numbness and tingling down into your hands. So when a patient comes to the office, what we do is a couple things. Number one, we evaluate what's going on in the neck by doing range of motion. So bring your head back, left, right, rotate. And typically we see like a person can go one way really well, but they get really locked when they go to the other way. The range of motion is really decreased. Secondly, we do what they call motion palpation. So we're taking the hands and we're moving through and we find out that in certain areas of the spine may not move as well or have as much motion into it. And then we try to exacerbate it. We push down on the person's head, we twist them around, we move some motion, and then we can get really, really fine-tuned as far as what and where it is. Last thing is I always check and make sure that the muscles that attach to the back of the neck, sometimes they are real spasms. You walk around, most people walk around and they kind of do this type of thing. Now, a couple other things. When it goes down to the outside portion of the arm, that's usually an involvement of a lot of the muscles, sometimes even lower in the mid-back. But if it goes down into the fingers, we can get really, really specific as far as where the nerve is being affected. Why? Because each one of these nerves go to different places of our fingers. So we can say, hey, look, it's coming down into this portion of my hands. Oh, then I know it's from a very specific nerve. Or hey, it's in this portion of my hands. Oh, again, I know it's from a little bit of a more specific nerve. So how do we treat it? Couple things. The most important thing is we got to get the pressure off the nerve, or we got to get motion and movement back into the joint, restore motion to the movement to allow the nervous system, the nerve, basically to not have that pain, that pressure. So as a chiropractor, what we do is we get very specific and we find the ones that are out of alignment and we adjust them. That is called a chiropractic adjustment. In addition, we work over the muscles that keep it tight to get them to relax. And then we also do some stuff having to do to try to open the disc space. So open the discs up, create more motion. Because remember, we talked about if you're sitting at a computer and your neck is like this, well, guess what? We need to get your neck back like that, right? So I got to teach you stretches and exercises to open your chest up, open the neck up a little bit. Sometimes we send people home with a little pillow-like thing that they lay on, which helps to restore the curve as well. Sometimes we do some different traction types of things. There's some different ways that we can go about addressing it. Now, how long does it take? Well, a lot of times when patients come in, within just, sometimes 1 to 2, 3 easy adjustments over the first course of the week, we'll see an immediate reduction in symptoms, meaning their pain, their numbness, their tingling will go away. If we're really concerned and we see a huge amount of curve and we're trying to get that curve backwards, and meaning trying to get it back into the normal curves, that can take weeks to months if we're going through a restorative phase of that. But as far as getting rid of the pain and stuff, usually within a couple of days to a couple of weeks of care, we see a huge improvement. So Sarah, thanks so much for the question. If you guys have questions about this, if you're experiencing this pain in the neck, down into the hands, sometimes we actually will see it down into both hands, please let me know. I'll do whatever I can to answer my questions. And if you're local here in Santa Maria, jump on in. We'll take a look at it and see if we can help you. All right, hope you guys have a good one. Talk to you.